So, you know how for months I've been worried about the variants and saying that we should definitely keep our masks on because these variants are going to become a problem because people aren't getting vaccinated, and we're going to continue to have different variants pop up, and eventually these variants are going to turn vaccine resistant. I would really like it if I was right about things that aren't basically world ending. And it's not even that like I'm that good at predicting shit. It's that this shit is obvious as fuck, and a lot of people are fully willing to tell themselves lies to make themselves feel better. And instead, what I do is I go, no, I like feeling like shit. Delta variant isn't just hypercontagious, it also grows more rapidly inside you. Also, keep your eyes on the Sigma variant, which is coming down from Canada. Being in the Midwest, I'm a little scared. After months of data collection, scientists agree the Delta variant is the most contagious version of the coronavirus worldwide. It spreads about 225% faster than the original version of the virus. It is currently dominating the outbreak in the United States. A new study published online Wednesday sheds light on why. It finds that the variant grows more rapidly inside people's respiratory tracts and to much higher levels. Researchers at the Guangdong Provincial Center for Disease Control and Prevention reported. On average, people infected with the Delta variant had about 1,000 times more copies of the virus in their respiratory tracts than those infected with the original strain of the coronavirus, the study reported. Holy sh! I mean, the silly thing that you ever hoped COVID wouldn't become a pandemic. Yeah. And you know what? My dumbass, like, for years in the Trump years, I talked about how the societal norms are done and that all our institutions that are supposed to protect us won't. And then for some reason, my dumbass thought that COVID would not be that big a deal. I was like, our CDC is good. We'll take care of it. And I forgot to factor in Trump. Owning your mistakes. I was wrong on that. I don't know what I was thinking. I'm the healthcare guy too. Like, for fuck's sake, man, what were you thinking? And then before I knew it, everything was getting shut down. And I got to spend the majority of my wife's pregnancy not being able to go to any of her ultrasounds. And we couldn't have our family visit us in the hospital. And it was the best. And, my dad missed out on almost the entire first year of his life before actually meeting him. Oh, it was amazing. It was so great. Yeah, I thought it was going to be another SARS. Yeah. I thought our institutions were strong enough to help us, even though I spent years talking about how our institutions are completely fucked. And there was a part of me that was correct, just not about this. I don't know what I was doing. I thought about swine flu at first, like it was dealt with because Obama was being careful. But we had Trump, so I kind of saw it coming. Yeah, I should have. I don't know what I wasn't smoking anything. That's the problem. See, now I'm on my way to being a pothead, and I can see more clearly where I fucked up. Do drugs, kids. They make you cooler and better. Please don't clip that. Have you had a gender reveal party? How big was the devastation? Should have at least got a blue hydrogen bomb. Look, I had a plan to blow up the moon. NASA said no. Are we even a free country anymore? Someone catches the Delta variant, the person likely becomes infectious sooner. Shit. On average, it took about 4 days for Delta variant to reach detectable levels inside a person, compared with 6 days for the original coronavirus variant. In the study, scientists analyzed COVID-19 patients involved in the first outbreak of the Delta variant in mainland China, which occurred between May 21st and June 18th in Guangzhou, the capital of Guangdong province. The researchers measured the levels of virus in 62 people involved in that outbreak and compared them levels in 63 patients infected in 2020 with an early version of the virus, otherwise known as the wild type. I don't know. Back in my old days, you make do with a metric ton of thermite and you were happy. Findings suggest the people who have contracted the Delta variant are likely spreading the virus earlier in the course of their infection. And the scientists underscored the importance of quarantining immediately for 14 days after coming into contact with someone diagnosed with COVID 19, as the U.S. Centers for Disease Control and Prevention recommends. Or even better, getting fully vaccinated. Get vaxxed. Your pronunciation of Chinese cities and provinces hurts. Look, I can barely speak English properly. You think I'm going to get Chinese? No, I'm very bad at it, and I know it's cringy. Yeah. I do my best. But I am definitely a very white man. Preliminary data shows that in some U.S. states, 99.5% of COVID 19 deaths in the past few months were among people who weren't vaccinated. The CDC's director, Dr. Rochelle Walensky, said Thursday at the White House, "We know the Delta variant is currently surging in pockets of the country with low vaccination rates. We also know that our authorized vaccines prevent severe disease, hospitalization, and death from the Delta variant." So let's going to be difficult for me to find stories on that. We're going to have a variant here soon, I'm sure. We already have oh, you mean coming out of here? There we go. Lambda variant of COVID-19 coronavirus is spreading. What you need to know. Soon incels will start trying to get the Sigma variant to become Sigma males. True. Compared to all the attention that the Alpha and then Delta variants have been getting, there has been relative silence of the Lambda until now. The Lambda variant of the COVID-19 coronavirus is not to be confused with Lambda, which is a forbidden... Who the fuck wrote this? Bruce Lee? Hoo-yah! Shame. Shame. But this variant has been progressively dancing its way around the globe. It's already become... Motherfucker. Bruce? Hoo-yah! You think this is a fucking game? Does this look like a game to you? The fucking puns. Are you kidding me? And it was a stretch too. Oh, hope an asteroid ends this shit before COVID kills us all. Yeah, I would like to be able to taste my last meal. I would not be able to do if I had COVID. This is a game and I'm winning. It's already become the dominant strain in Peru, which has had the highest COVID-19 case fatality rate and deaths per capita in the world. It's also spread to at least 29 countries in 5 different World Health Organization regions. So the question is, will this version of the severe acute respiratory syndrome virus, SARS CoV-2, Lambda, the world Lambda the world into even more. I hate this so much. I hate this fucking man. I'm completely ready to just find another article who wasn't written by a fucking child. Dude, this thing is killing people, and you're over here making puns. I thought it was pretty punny. Shame. You know shit's popping off if I'm doing the zoom in. It's hard to say. Oh, man. My eyes glanced ahead. It's hard to say right now. Much to learn about the Lambda variant there is, as Yoda would say. Currently, the Lambda variant is like your dad wearing a one-legged cat suit that's way too tight for the first time. This is Forbes. This man writes for Forbes. I can't. I cannot. Serious question. Do we keep going with this article for the memes? Oh, give it to me. Just hit me. I want to feel choked out. Even for the memes, it's harder. Yeah, it's a problem. This is a problem. We'll start this paragraph over just so we can get the whole effect of this guy who is so goddamn proud of what he did. He shouldn't be. It's hard to say right now. Much to learn about the Lambda variant there is, as Yoda would say. Ouch. Currently, the Lambda variant is like your dad wearing a one-legged cat suit that's way too tight for the first time. Kill me. You can see some disturbing signs, but you can't quite see or figure out everything that's going on yet. I need a minute. I don't know what you want from me. This hurts. This hurts. I feel like I'm being abused reading this. The Lambda variant has been around for a while. It was first detected in Peru back in August 2020 and has steadily grown in presence there. Eventually, the Lambda variant became the alpha, or the top dog, of COVID-19 coronavirus strains in Peru. Motherfucker, people are dying. People are dying. Since April 2021, sequencing of COVID-19 coronavirus cases in the world has found the Lambda variant in over 80% of the samples. COVID-19 pandemic has hit Peru particularly hard, too. As of July 9th, Peru has had a total of 2,074,186 reported COVID-19 cases, with 193,909 of those resulting in death, yielding a 9.3% case fatality ratio and a 596.545 deaths per 100,000 people in the population, according to the Johns Hopkins Coronavirus Resource Center. Those numbers have made Peru number one globally in both categories, and in this case, being number one is not good. Are you serious? I can't believe you would make that declaration. How dare you? The author probably wrote this on a brunch break. Be nice. I think he took a lot of time to write this and was very proud of it. You could tell by the way he structured everything that he's just like, this is gonna slay him. This journalist started learning about the COVID variants and it jokerfied him. You know what? Can you think of a better? Yeah, uh, you're right. You know what? He he wants to stop pretending this isn't funny. Because what else are you gonna do? We live in a society. On June 15th, WHO report noted elevated prevalence of the Lambda variant in multiple other South American countries as well, including Chile, Ecuador, and Argentina. That's okay for Argentina. Just make sure that it kills all the Nazis. I mean, there's no Nazis in Argentina. Why would I say that? According to a Public Health England report, as of June 24th, 2020, this variant has appeared in 525 samples from the US, 87 in Germany, 86 in Argentina, 57 in Mexico, 43 in Spain, 19 in Israel, and I guarantee that's, of course, all in just Gaza. It'll all be Palestinians. We find out. And then, like, the WHO will be like, okay, so what did you do to treat it? And they'll go, treat it? Read it. 15 in Colombia, 13 in France, 8 in Egypt, 7 in Switzerland, 6 in the United Kingdom, 5 in Italy, 3 in Brazil. This is just padding out your article to make it longer. Netherlands, Aruba, Portugal, Denmark, Czech Republic, Turkey, Australia, Morocco, and Zimbabwe. Oh, and Canada. Anyways. This version of the virus, otherwise known as the C37 variant, made the WHO's variants of interest list on June 14th, 2021, joining other variants like the Eta, Iota, and Kappa ones. These Greek letter names all may sound like fraternities or sororities, but if someone asks you to rush the Lambda variant, it's better to say, "Get the heck away from me." In this case, interest doesn't mean, oh, that would be cool, like a statue of Ariana Grande made out of hot dogs. Instead, interest here means that public health officials should watch the variant very closely because it could become a major threat. A VOI is a version of the virus that, in the words of the WHO, has genetic changes that are predicted or known to affect virus characteristics such as transmissibility, disease severity, immune escape, diagnostic or therapeutic escape. And that is spreading so that it may be an emerging risk to global public health. A VOI is one step below a variant of concern. The alpha, beta, delta, and gamma variants have already made the VOC list. The lambda variant doesn't qualify as a VOC at this moment because studies have not yet confirmed that it is more transmissible, causes worse illness, or better able to get past the COVID-19 vaccines or treatments than other versions of the virus. The keywords here are have not yet confirmed. There just haven't been enough studies so far to draw any strong conclusions about the Lambda variant. The situation in Peru does not raise concerns that the Lambda variant may be more transmissible and more likely to result in worse COVID-19 outcomes. However, other factors can affect the spread of the virus and resulting death rates, such as access to healthcare and the presence or lack of control measures, such as social distancing and face mask use. By the way, the CDC just announced this week that teachers and students who are vaccinated don't need to wear masks.
Did a hell of a job of your job.
Okay, with the rim shots, it sounds like he used to write for Leno. You want me to do it as Jay Leno? And be like, this week we had Yoda come in and weigh in on the COVID variants. Have you seen this? Have you seen this? It might make it slightly less painful. However, the other factors can affect the spread of the virus and resulting death rates, such as we already read this. Therefore, Peru's higher death rates may not be solely due to the characteristics of the virus. The spread of this variant to so many other countries does lend more thought to the possibility that it is indeed more transmissible. Of course, every time a new variant emerges, a big question of how well currently available COVID-19 vaccines may protect against the variant. Early indications are that COVID-19 mRNA vaccines may still offer good protection, as you can see by this tweet from Peter Hotez, MD, PhD, Dean of National School. He's got a lot of credentials. What he's saying here. Hotez cited a preprint that's been uploaded on the BioRivix website. A preprint describes a study that took antibodies from the blood of people who had had COVID-19 previously or had received the COVID-19 mRNA vaccines and determined whether these antibodies were able to neutralize the Lambda variant of the COVID-19 coronavirus. The not so good news is that the Lambda variant was able to infect cells more readily than the original version of the virus. The good news is that the antibodies seem to neutralize the Lambda variant. This provided evidence that currently available COVID-19 mRNA vaccines may offer good protection against the Lambda variant and that the Regeneron monoclonal antibody therapy cocktail would remain effective against this version. Keep in mind, though, that the preprint is not the same as a peer-reviewed publication in a respectable scientific journal. That's good to note. That should have been noted at the beginning, but who cares? What's responsible journalism? All you need to upload a preprint is a computer, internet access, and someone besides a hamster to press the right keys on the keyboard. Hamsters are not always great with keyboards because they can end up typing expletives. I think I'm having a... More studies are needed to determine whether the Lambda variant is actually more transmissible and more likely to cause more severe COVID-19, and whether it can get around the protection offered by currently available COVID-19 vaccines. Emergence and spread of the Lambda variant is a reminder that the COVID-19 coronavirus is not going to stay the same. The virus is not like that adult who peaked in high school and still insists that beer funneling is cool. Gonna vomit. Instead, the COVID-19 coronavirus is more like Madonna in that it continues to evolve and adapt to the times. Bruce Y. Lee. I need to write a tweet. Here. Let me help. There's the article. I hate it. And you know what's even worse? I'm going to clip this out for YouTube. Because why wouldn't I? Who doesn't like pain? Oh my god, it is so fucking bad. It gets worse. I skipped ahead a little bit and saw what's coming next. Like a drunk person trying to make photocopies of his or her butt. How intersectional. Every time the virus replicates or makes more copies of itself, it can make mistakes. These mistakes result in mutations in the genetic codes of the resulting copies of the virus, such mutants are in effect new variants. That's why it's so important to slow the spread of the virus as much as possible, at least until enough people can be vaccinated to break the chains of transmission. As long as COVID-19 coronavirus remains so widespread, unvaccinated people can serve as variant factories. In other words, when you don't protect yourself against the virus, your body serves as a cheap motel. The virus can essentially say, your body is a wonderland and I'll use my spike proteins. You know what? No. This isn't exactly what John Mayer has sung about because he is not a gigantic virus. That is debatable. That is debatable. Is Tina still here? Someone please clip that and send it to her if she's not here anymore. But it's close. Getting vaccinated won't completely protect you against getting infected, since the vaccine is not like a impenetrable concrete full-body condom. Mm-hmm. However, the vaccines do offer very good protection and may make the virus effectively say, "Damn, baby, you frustrate me." All of that guy's article said like this. I try not to hate people. I really do. I'm not someone who sees the value in all out hatred of a human being. Because I don't feel like there's very many people in the world that are deserved of such disgust from a human being. It's close. This fucking close. Another one starts with, while a hippo may prevent your employer or other businesses from asking you about your COVID-19 vaccine status, HIPAA won't. You know, I just said it was this close. Come on. I hate this man. Hate him. If you aren't vaccinated, it's best to maintain other COVID-19 precautions like wearing face masks and social distancing. This not only will protect you, but also protect the rest of society by slowing the emergence of variants. You ever just think about, just offhand, like, wonder what it would be like to choke the life out of a human being? Completely unrelated, by the way. Oh my god. So yeah, please be careful. Please be careful, people, because quarantine, it's not over. It's not over. It's never going to be over. Are you kidding me? At this rate, we're going to be in our 80s talking about very double sigma or something. I don't know. He sounds like he led a long life, hasn't he? Yeah. All things must come to an end. I'm against the carceral system, but I'll make an exception for that author. Jail for 1,000 years. Yes, absolutely, Camel Spider. Good to see you, by the way. Hey, it's Mark and Eli. I hope you're doing well. Hope you liked the video. If you liked it, why don't you like, comment, and subscribe? My child may stop picking on me. Oh.